Well, thanks for doing this. I really appreciate it.
Thanks for asking. Thanks for all you're doing. Oh my gosh, it's great.
Can you just give me a brief overview of your experience with dogs?
Yeah, I've been training dogs for about 32 years. I'm certified dog trainer, certified behavior consultant, and trauma-informed approach professional. And I've been doing behavior for probably about 20 of those 30 years.
Okay, nice. Awesome. What do you hear as the typical sales pitch for using prong collars and shock collars?
Oh gosh, let's see. I hear everything from like, oh, it doesn't hurt to it's a TENS unit. Often it's like tapping you on the shoulder. It just gets their attention. It's not painful at all. So that's what I hear a lot of around here.
Right. Yeah, that's pretty typical. A lot of the other people have said that these pain trainers will say that it gives you control.
Yeah, they talk a lot about dominance, which we both know has been, debunked. And you've got to be in charge of your dog. Your dog's just trying to control you. And by putting this on, you'll get the control back. Of course, I hear that.
Do any of these pain trainers ever warn their clients about the potential fallouts of shock collars or prong collars?
No, I find that they don't, and I rarely hear them talk at all about fallout. Tend to just tell them all the benefits. And, they don't, whether it is the shock collar, whether it's the e-fence, they don't tell them about what the possibles, I call it fallout or side effects, can be by using those tools.
Yeah, because they're probably just in it for the money.
Absolutely. I had a client just this last week, as I was thinking about our meeting today, that had spent $4,500 on their 2 dogs. And when they got home, they just couldn't use the shock collar. It was too traumatic for them to use it. And $4,500 later, they reached out.
Yeah, I had a client last year. She lives 10 minutes from me. I charge $300 for an initial session. It's 90 minutes to 2 hours. I give my clients a lifetime of text and email support. And she said, well, I think I'm going to go spend $3,000 and send my dog away for 2 weeks in upstate New York. And I said, why would you do that when I'm 10 minutes away? And I told her, I said, these board and train programs, they do horrible things. I know there's positive trainers who do boarding and they're great, but the vast majority of these send away programs are really horrific.
I always joke, if I could be sent away for 2 weeks and modify my own behavior, I would be the first in line. I would never eat chocolate again. I would work out by 8 o'clock every morning. I mean, we know, you can't modify our own behavior, and we know the motivation behind our changes, in 2 weeks. I would be the first to sign up if something like that worked.
The other thing I remind people when they're considering it, I say, well, look, even if you have a trainer such as myself, because I board people's dogs, even if you had me and I had your dog for 2 weeks, your dog's going to be trained with me, right? You need to work on your mechanics. You need to work on your timing. You need to be the person who's, training your dog. I said, I can help you, I can show you, but, I'm the coach, you're the player. That's how I usually frame it. What have you seen in your travels as the fallouts from using shock collars and prong collars?
I've seen everything from dogs that are globally fearful. I've seen aggression. One of the most traumatic cases was a dog that I had that was sent away. I watched her for the client, not a board and train, but just watched her for the weekend. They had an emergency, and the dog was great with me all weekend, nervous. But as soon as the client returned, I actually put the dog in the room, put up a baby gate, and then told the client to come in to get her dog. And the dog saw her and turned around and tried to attack me. And she said, well, how did you know to put the dog behind the baby gate? And I said, I remember one of my first training, sessions 20, 30 years ago, when one of my mentors taught me that when you use the shock and the owner is present, the dogs will take that picture. And this dog literally flipped the switch once they saw person, their guardian and me, and flipped that switch and just would have attacked me if I was not behind the baby gate. So I've seen that. Oh my gosh. I saw a dog comes in. I train at a bakery where I've trained for many years. And the dog came in and they have one of those little dings on the door. It makes a little sound when you come in, just a little ping. And that dog literally pancaked on the floor and would not move in the doorway. And they had to go pick him up because that little ping had brought back enough of a memory for that dog. And as we know, they will often never recover from this. And that was one case. Again, I've seen globally fearful. I've seen increases in anxiety, aggression, fear, things they weren't afraid of before.
Yeah, that's the generalization of fear that these pain trainers either don't understand or don't care to understand. It's one of the two. They either, and my suspicion is they don't even understand behavior, because how could you understand, right? Like, if you understood behavior and how it works, why would you cause more fear and pain to a dog?
Right. If you understand how the brain works and how fear can impact parts of the brain, I don't think they understand. I even think sometimes clients don't make the connection because, I'll say, well, none of us are saying that it might not stop that immediate behavior. Okay. I'm not going to lie and tell you that, yeah, it might stop the barking, but what's left in its place? And is that the trade-off you want to take? And permanent damage it can do. And, sometimes I feel like it's a week later, but sometimes I literally had a dog that went on a shock collar, and I'll never forget, like, they had their first bite within like 12 or 14 hours. So, I mean, it was right in that window. It can be a few months later. I always joke when, I know nobody uses checks anymore, but when the check is dry, the ink is dry on the check, 2 or 3 months later, suddenly you have a dog with aggression. And, even, the guardians don't put this together. And I honestly don't think those people using those tools put those together, because if they did, they wouldn't be able to sleep at night.
My suspicion is a lot of these pain trainers, I don't even think they like dogs.
Oh yeah, I think there's and I mean, we know this already. There's a psychological reason why some people choose to resort to that. It's reinforcing for the punisher. So that's a whole nother rabbit hole we could go down, but I would agree with you. I don't think they like dogs. I think a lot of them have control issues and, some issues probably of their own. I'm no psychologist. I don't profess to be one, but I don't think that anybody who cares about dogs could do that and watch that and see that and not take the time to understand that that's going to do damage.
Yeah, I mean, just on a human level, it just, you see a dog being hurt, how can you not feel bad, In your travels, have you ever seen any of these trainers use any sort of behavior assessments before they made that decision to use shock and choke?
I mean, I have literally had them go, a lot of times around here, they'll give them that free or that discounted consultation. And literally within minutes, I mean, instead of asking what triggers the dog, how long have you had the dog, what else might be going on? We look at immediate stressors and, triggers, but sometimes, those of us who work in behavior, we also look at, some of the distant, we call them antecedents that, might impact, is the dog alone 12 hours a day? Is the dog having outlets? And I mean, literally, they will often fit these dogs, often puppies, who are being puppies. Dogs will be good at being dogs. They jump, they bark. We'll fit them within minutes of, a prong, a shock collar, or as they call it, an e-collar to soften it, Call it what it is. So, often within, they'll tell me within minutes or the first session, or, I've seen 3-month-old puppies. Oh, you got to get this and this tool on them. Never asking any questions. So no, I do not see them assess the dog, ask what the lifestyle's like, ask what's going on, even find out if there's a bite history, and then they're putting kerosene on a fire for some of these dogs.
Yep. In the last question, you took the phrase I say all the time. You took it right out of my mouth. I say, sure, any legitimate behavior person will tell you that you can stop behavior with shock and choke, maybe, but what's left in its place? I always say that. What do you have after, How much more work goes into training the dog after these fallouts occur from shock and choke?
The famous thing we say, I believe I quote Patricia McConnell, it depends. And probably every other behavior professional, it really depends. A lot. I can tell you, there are some studies that show they never fully recover. Fear never leaves portions of the brain. I mean, think of something you or I are afraid of. I mean, I joke all the time when I go to the doctor, I'm afraid of needles. I mean, I know exactly when it goes back to when I was 2.5 years old. So, those of us who, the more you know about the brain, you understand that, yes, we can help these dogs. As professionals, there's so much we can do. So I don't want to ever, have people feel like there's not help. But it's an incredible amount of work to undo the level of fear, anxiety, stress, and/or aggression that these tools create. An incredible amount of work, an incredible amount of client commitment, an incredible amount of time, often resources, often needing a vet behaviorist or a vet savvy behavior or a behavior savvy vet on your team. So it's work for sure. And I see a lot of clients put in the work, but it's definitely an incredible amount of time and resources.
And if people just avoided using shock and choke, they would have a much easier time training and they wouldn't have as much risk. So why do it? What would you like the legislature in New Jersey to know about the use of shock collars and prong collars and why they need to pass this bill?
I would like them to know it's banned in some countries, that it has serious, fallout, and that, it can increase anxiety, aggression. I mean, we have these dogs out in our community that, now we have dog parks and we have dogs everywhere. And I think it's not just about that person and that dog. I mean, I think it puts other people at risk, children, other dogs. When I always say it's like brain misfires often after they've used these tools, and that misfiring isn't just always in the home. I mean, yes, sometimes, but sometimes that's out in public, or, the little girl walking her dog down the street that now this dog attacks, or runs through the, e-fence. So, I mean, I think it's a dangerous tool, and it's no way to train our best friend.
Yeah, to a person, everybody has said it makes the community less safe.
It absolutely makes the community less safe. And we're taking dogs, to events. I mean, I've seen dogs at my local farmer's market with their shock collar on. And I mean, I give them such a wide girth because I know, what that dog is like a ticking time bomb to me. And, it makes our communities less safe for sure. It makes our shelter and our resources that we're putting into, a lot of shelters are, in the city and things like that. I mean, there's more resources and funding going to try to place these dogs. So, I mean, there's just fallout in a number of areas, and it's, the science is out there now. This is not an opinion question. I mean, the science is out there that these tools are not a good way to train our best friend and have serious fallout.
You're really good at this. You have very nice, succinct answers. It's going to make editing really easy. I appreciate it.
I'm not on my game. I've just done a couple calls this morning already about guess what.
Oh, really? Yeah.
So.
No, I appreciate it. No, I appreciate it. Is there anything else that you'd like to add, or any stories or anything that you want to contribute past these questions?
I would just say, when people say, how do you feel about shock collars? And I'll tell them, I probably should say good, because they keep me with a very long wait and they keep me in business. But honestly, as an animal lover, which I am first and foremost, I hate them and I would love to see them banned. But yeah, they are the sole reason that I have such a long wait, I feel like, is because people try to take the quick, expensive route without being well informed. These people are not certified. I say they run these chains. I mean, chains are great for hamburgers, not so great for working with, a dog that's going to be on our community, that has the potential to do damage, and that, that does, according to studies, they increase anxiety and aggression. I mean, it's we have enough studies out there to show that this is not acceptable, and the way we treat our animals in this country should reflect what we know, and we should do better.
Agreed.